Hello and welcome to this short video around insulin safety. My name is James and I'm an Eden educator.
Hi, and I'm Fiona.
So this year, Insulin Safety Week is between the 17th and 23rd of May. And at Eden, we thought we'd focus around injection sites and in particular Lipohypertrophy or Lipos, something that has been quite difficult to monitor over the past year due to the way we have had to manage our diabetes reviews and largely switching to phone consultations.
Yeah, so we'd like to just think about how we can still do our best to help patients look after their own injection sites and why that's really important. And just to remind us as healthcare professionals how important this little check is.
So there'll be an infographic available on the Insulin Safety Week and Eden websites that will hopefully be really helpful to you. But Fee, whilst we are here, do you want to explain why it is so important? After all, lipos are just rubbery, fatty bulges of lumps in the skin, aren't they?
Well, yes, they are. And they come in all shapes and sizes, as we know, some tiny little hard ones and some big blobby ones. So the main problem is that they can cause insulin to be absorbed erratically or unpredictably. And that's can present difficulties because sometimes people will need much more insulin than they should because they're injecting into these fatty lumps. But sometimes when it is absorbed really well, it can put them in danger of having a hypo. And that's what we want to really prevent if we can. So if someone presents with a history of erratic blood glucose readings, you look at their readings and they're a bit all over the place, it may be an indication that there's some lipohypertrophy. So James, do you want to remind us what might cause lipos?
Yeah, sure. So I guess you could say there are three sort of main key things to check which can cause lipos. So the first is needle reuse. So reusing needles is a strong indication for lipos. Hypodermic needles are manufactured to be disposed of after one injection only. And repeated use causes increased pain and less effective delivery of the insulin as well. So the second is injecting into the same site. And injecting into a lipo doesn't usually hurt, and people can also subconsciously favour one particular area. So a person may also favour a particular area due to factors such as poor dexterity and also frail, thin skin. And then the third is injecting large doses of insulin. So lipos are more common in people who are on larger doses of insulin and have used insulin for many years. So switching to concentrated insulin can help because a lesser volume of insulin will be administered. So now we've identified some key causes, I think it's a good time if we talk about the care, support and advice primary healthcare professionals can provide to their patients.
Yeah, okay. So the main thing is, and this is what we really want to get across today, is what to do if you do detect or you do suspect that someone has lipohypertrophy. So it might be getting them to come into the surgery and having a look yourself or getting them to send photos in. But the main thing is that it's best to encourage them to rest this area. The length of rest needed will vary on how big that lipo is. So if it was a really small one or you've just detected it, you think that's not been there for too long, it may well recover in 3 to 6 months. If it's been there for years and that's the place they've always used, then probably never go back there. It may need an eternal rest. So it does vary. But it's difficult sometimes to get people to change almost the habits of a lifetime, to change their habits in getting them to move injection sites. So that's something we can talk about as well later. But the two main important things, really, really important things, are to remember, one, to reduce the amount of insulin dose when you do move sites. So if you're moving away from an area of lipo, you must reduce that insulin dose to keep them safe and help prevent hypos. So most recommendations say about 20% reduction in insulin. If they've moved away from a large lipo that's been used for a long time, you might need to reduce by as much as 50%. So it's a kind of try it and see. And the second point, therefore, is to do lots of testing. Encourage lots of testing, especially over the next few days whilst you change sites. And it's better to reduce by too much, probably, and then titrate back up rather than to risk hypoglycemia.
Yeah, so I think that's really great advice, Fee. And then also you can work out together following those changes, plan for rotating sites as well, ensuring that, there's lesser risk of reoccurring injection site issues and lipos as well. So I think that sort of brings us to a nice point to end, really. And just so you know, there's more helpful tips on our infographic for this year for Insulin Safety Week, which details things around how to ask your patients about their sites during a consultation, how to teach them to examine themselves, like checking in the mirror and observing and feeling, and also how to adjust insulin doses to avoid those hypos, as Fee mentioned earlier on. And if you enjoyed this presentation, then why not join our Eden webinar scheduled for the 18th of May, which talks about further things in relation to injection safety. So thank you for listening, and remember, think lipo, think hypo. Thank you for listening. Goodbye.
Bye.